All right. Good afternoon, everyone, and welcome to From Built to Buy-in, Human-Centered Design and Change Management in Digital Services. My name is Suzanne Boyd. I'm the founder and CEO at AnthroTech, and I'm thrilled to be hosting today's conversation. Thank you all for joining us. We all know that delivering effective digital tools in government is never just about the technology. In fact, research from McKinsey shows that 70% of digital transformation efforts fail, not because the technology is flawed, but because the people and organizational systems around it weren't fully engaged. Very often, the people who need to use, support, or champion new services are brought in too late or not at all. And when people become an afterthought, even the smartest technical solutions can struggle to take hold. And that's why today we are focusing on the very powerful combination of human-centered design and organizational change management. These two disciplines must move lockstep. Together, they ensure that digital services are not only usable and accessible, but also adopted and embraced and sustained inside complex environments. We have an incredible panel with us today. We have leaders from federal, state, and city government. Each of them brings a very unique perspective and a ton of real-world experience in making digital services stick. So you are going to hear some candid stories, some practical steps, and tested strategies for advancing human-centered design organizations and delivering services that truly work for people. I am so delighted to have this amazing panel with us. Welcome, Wanda, Michal, and Taylor. Next up, I'm going to hand it over to you. If each of you could please introduce yourselves, share your name, your agency, and a little bit of background when it comes to that combination of human-centered design and organizational change management. And Wanda, I would love to start with you.
Sure. Good afternoon, everyone. My name is Wanda Brown, and I'm a former program director at the Internal Revenue Service. I recently retired in May 2025. So I'm here on my own capacity. I spent 20 years at the IRS, most recently focused on digitizing processes and delivering digital services. I led the document upload tool, which is fondly called the DUT, and it really allows our taxpayers to, instead of getting that gut punch when they receive a notice from the IRS, they can go directly, they don't have to go to the mailbox, they can go directly to irs.gov and upload that document. There were about 3,600 notices and letters involved in this initiative. And the big emphasis is around making sure that it was something that was easy and quick for our users to use, as well as all of the change management that was required for all of the back end processes. So I'd like to talk to you a little bit about that today.
Yeah, thank you, Wanda. We're going to dig into that as a case study a little bit further. Let's go to Taylor.
Hi, good afternoon. My name's Taylor Linke, and I currently serve as the Chief of Staff for the Washington State Healthcare Authority. So our agency is responsible for the distribution and oversight of healthcare benefits for what we fondly call Apple Health, or our Medicaid population, as well as employee and retiree benefits and behavioral health services. I've been here almost 10 years. And I like to think that my career in state service, which actually started over 20 years ago, happened by chance, but I've stayed by choice. And when I think about that, I was given an opportunity in the State Department of Health. And when I took my first role, I really began to see how there was a lot of opportunity for problem solving and looking at processes and seeing how we could do things differently. And I sort of was sucked in. And I became an agent of disruption And I really was the person that asked why and tried to figure out how could we do it differently? Because the people of Washington rely on us for a variety of services, and there's got to be better ways for us to deliver on those services. So, really sort of began to invest in my own learnings with Lean Six Sigma and agile methodologies and organizational change management. And then most recently, really started to explore human-centered design methodologies and how there's a synergy between all of those other things that I mentioned and human-centered design. So definitely excited to be here and to learn from my fellow panelists and to share a little bit about a story that we had here with the Apple Health Program.
Excellent. Thank you, Taylor. Thanks for being here. Michal, over to you.
Hi, good afternoon. I'm Michal Perlstein. I lead digital engagement for the city of Seattle. We've been doing this almost 9 years. We introduced and scaled human-centered design in city digital services since 2017. The names have changed. The agent of disruption made me laugh when Taylor said that because I've worked across sectors, public, private, nonprofit, and before being in local government, I was in K-12 education, and my roles are always, because of the varied backgrounds that I bring, they're often to either create change or establish something brand new. And that's what we did here. Our portfolio includes public communications platforms, the design system, digital policies, and more. We work closely with partners across city departments, and we consider those internal stakeholders as a really important user group. And that's how we have to focus on change management and usability, not just for the end user and the public, but also internally. So we'll talk a little bit about that too.
Yeah, thank you for making the time call. Thanks for being here. You're all agents of disruption, and I feel like we're probably in the company of more agents of disruption when I look at the audience here today. Next up, we're going to sort of pivot to stories from the field and have each of you describe a case study that really illustrates that powerful combination of human-centered design and organizational change management. And for everyone in the audience, please start jotting down some questions. After each of our panelists shares the story, we're going to start taking questions and going to dig into those case studies a little bit more. So with that, Wanda, would you do us the honors of starting with your story?
Sure. I'll go ahead and talk a little bit more about the implementation of the document upload tool. We implemented at the fourth quarter of 2023, and it launched in less than a year, right? We had some small prototypes out there, but we really expanded it to take care of all notices and letters that, our taxpayer receives from the IRS. Um, it really changed the way that our taxpayer interfaces with the IRS. Normally, you'd wait in the mail, you get this letter or this notice, and you go, oh my goodness, how do I respond to this? I have to speak from my own personal interaction. I received a letter, and as an employee from the IRS, and you get a letter from the IRS, you're like, oh, what did I do? How do I respond? I don't have a fax machine anymore, right? Where do I go and find a fax machine to get my documentation together and fax it over to them? Or, oh my goodness, I got to stop by the post office, right? It changed the way that our taxpayers interface. So we had to have a very easy way for taxpayers to access the portal, find out how to which letter or notice they have, and to respond. So that required a little bit of human-centered design to make sure that it was designed for ease of use, right? So it didn't take a rocket scientist to be able to find out how to use it and to respond. And when you think about from May 2025, there were nearly 7 million views on this particular portal. And it was used to provide over 1.7 million documents to allow people to respond to these notices. So for me, when I got that letter, I was running around trying to figure it all out. And when I heard about the document upload tool, I was like, what a lovely way to be able to respond to the IRS. So just thinking about that, the personal impact it had for me, I really had a passion to work and identify all the stakeholders in the organization that were impacted to really understand and implement organization change management, right? If you think about the change that our employees, starting with our executives, senior managers, to our frontline employees, the change was very dramatic, right? No longer would they be sitting and receiving stacks and stacks of paper. They would have to go to a digital channel, right? That they had not been used to doing to receive the input from the taxpayer. It really required a lot of training. It required a communication plan to make sure we were sending the right messages at the right time to the right people. It required an open forum for communication, right? All of our leaders really needed to understand and to embrace this change, right? Even though they had a lot of questions. There was a dynamic in the organization where the technology is not going to work. The technology is not going to support this. The technology was fine. We had the technology. Now it was around how do we change our internal business processes to focus on going to a portal to receive documentation as opposed to waiting for paper, right? One of the things that was really, really important was having a forum where leaders could come to, where senior managers could come to and understand what was happening, right? Just being able to have that discussion and for them to get ready for the implementation of the new technology and really getting that buy-in and commitment from the senior leadership to move forward, right? Even though if someone came up, well, this is the reason why we can't do it, well, let's work together on identifying a solution to how we get around it, how we get over the obstacle so that we can provide this service to the taxpayers. So it's a lot of work, a lot of thought has to go into who's impacted, how are they impacted, what does the current process look like, and what does a to be process look like, and identify all of those activities that get you to your implementation point.
Yeah, it's an incredible story. And I love what you said about the technology was fine. It was the people and process transformation where the work came in. So thank you for sharing that, Wanda. Let's go to Taylor.
Sure. So, part of what Wanda said really made me think, and, I'm sure some of you have heard this before, but, it's not about what we said or what we did, but it's about how we made someone feel, right? And those emotions leave lasting impressions as memories. And the example that I have for you is during the COVID-19 pandemic. So as I mentioned, our agency is responsible for Apple Health or Medicaid benefits for Washingtonians. So we cover, at the time prior to the pandemic, right around 1.8 million lives in Washington. And when the pandemic happened, as we all know and felt, the world stopped. Everything looked and felt differently. And for the first time for all of us, we had that opportunity to have a shared emotion, a shared level of uncertainty. Many times for Apple Health beneficiaries, they feel uncertainty day in and day out about where their healthcare coverage is coming from, potentially where their next paycheck is coming from, how they're going to get from, their home to the school to get their kid to the doctor's appointment. Whatever that was created uncertainty. And during the pandemic, we all felt that. And so for us, there was a period of time where for approximately 3 years, there were federal regulations in place that essentially prevented us as a state agency from terminating coverage for anyone on our Apple Health or Medicaid benefits unless they met very specific criteria. And that was obviously so that we could ensure that people had critical coverage during a very pivotal moment in our, world's history. But what that also meant was that we had a surge of people who came onto our Apple Health program who we had never communicated with the normal process for annual renewals. They didn't have to go through that process because those federal regulations were on pause. So when the pandemic began to wind down and the federal regulations began to shift, we had to start picking up our activity again for doing annual renewals or redeterminations of coverage to make sure that people were still eligible. And when we started this process, we quickly identified that there were roughly 25,000 Washingtonians who were losing coverage every month.
Oh,
Think
wow.
about that. Your healthcare coverage, you have it for 3 years. No one ever communicates that you need to do anything about it. And then all of a sudden, processes pick back up and we're losing healthcare coverage for 25,000 Washingtonians a month. Not because they're not eligible, but because they were getting lost in our administrative processes. They weren't familiar with what they needed to provide to us. So we have a great team that is very passion focused and mission driven. And so we partnered with our call center agents who were on the front lines getting calls from individuals day in and day out about that loss of coverage. And as they would call in, we started to implement a survey to ask those individuals, what's their preferred method of communication? Had they received the letters that we had sent? Did they remember what was written in the letters? How was it that we were getting to this point where they had lost coverage and now they were calling in to do something about it? And so through that process, we were able to gather the voice of those we served, and we learned that their preferred method of communication was text messages. They wanted us to send a text message before we sent the letters so that they could be alerted that the paperwork that was coming in the mail was really something they had to pay attention to. We also learned that nearly a third of those individuals that were losing coverage were losing coverage or finding out about their loss of coverage when they were at the doctor's office, after they had already made that trek to pick up their kiddo from school to bring them in to the healthcare provider. And so they were having to reschedule appointments, and that evoked emotions. And some of those individuals may never sort of go back to see the healthcare provider if they don't have coverage. So for us, we really wanted to focus on how could we minimize that disruption and loss of coverage for Washingtonians, and how could we do it in a way that sort of focused on meeting them where they were, providing them the information similar to what Wanda said, at the right time in the right place so that they could actually do something with it. And how could we do it in a way that also was able to support our team members, our staff, who were having to navigate these new processes as well, right? I mean, we had to essentially do redeterminations or renewals for over 2 million people in a 1-year time period. So our staff went from not having this workload and volume to having the floodgates open and having to navigate those new processes and policies themselves while people were calling in with a real sense of urgency because they needed this critical coverage. They knew they were eligible and they didn't know why they were losing that coverage. Yeah. So, I think for me, thinking back, Suzanne, to what you said at the beginning, it's the power of people, right? Like the people factor, you can't underlook the impact that can have. And so I just think about, we had to work through a lot of change management, both internally for our team members and externally for those we serve. And we had to approach it from the lens of not just applying the same assumptions that we had always applied in how we did the process, because we had so many new people who had come under our coverage roles in that 3-year pandemic time period who had never experienced our quote unquote normal processes. So we definitely focused on human-centered design, on organizational change management, And I think for us, the discovery was in the digital delivery of the text message campaign. That wasn't something we had ever explored before. And seeing the success of that and how that really made an impact, and we immediately began to see a decline in the people who were losing coverage for, administrative reasons. And it allowed us to provide more coverage for more Washingtonians at a point when people really wanted to make sure that they had those benefits in place.
Yeah. Another very powerful story. You're giving me goosebumps here, Taylor, and just a testament of the power of human-centered design and asking your customers, how would you like to communicate with us? So that's what a powerful solution. Michal, you're back. Let's go to you and have you share your story.
Sure. So I want to talk about some of the topic pages and specific types of pages we created on Seattle.gov, but I have to explain a little bit about how we got there with using the human-centered design. So in 2021, after about 2 years of research and design, we introduced new website navigation and taxonomy using plain language. We aim to provide a consistent, usable, and inclusive user experience or digital experience for the website and everything. On the analytical side, we audited content from across the website's 10,000 pages, collaborated with the customer service bureau to understand what their top requests are, looked at the website search terms, noted trends in web stats. We also noted the needs of our citywide personas that we'd created, examined other government websites for comparison, and set up usability studies. So as we iterated on designs and synthesized results, we'd continue to improve. So this set the foundation for updating the homepage and expanding the idea of topic and audience pages on the website. These types of pages aren't really information in themselves. They aggregate information that exists elsewhere, deeper in the information architecture from other programs and services across multiple departments. And the reason we do this is to focus on the mental model of our users or our visitors instead of a siloed approach where we assume someone knows where to look for it, which department is embedded and provides that service. So from a topic page, like with a simple URL, like seattle.gov/grants and funding, users can link to pages deeper within the architecture, but they know they're going to find stuff related to grants and funding. And they don't need to go everywhere to find fantastic information and services that people manage, but it's a huge city. So before we launched the site-wide navigation, we piloted a specific set of topic pages that we called major events and hazards, and they were focused on weather-related emergencies. So during an earthquake or a snowstorm, people may need information about city services, and we need to provide a clear destination. Think about internet outages or low battery on your phone, like you don't have time to go search for things, and we don't want to force them to do that. But those services that seem related might actually be managed by various programs in distinct city departments. So it's our job to bring that content into a cohesive structure and destination. So the first page we did was called Winter Storm Response. It was intended to be a pilot from which we iterate and apply learnings for future events, which we did. So we identified stakeholders early. That would be both program managers and communication staff, because sometimes they're different people across the city in all departments. And then through interviews, content audits, and later design sessions, our team created a page schema, a separate page schema for this type of event. They included a brief overview of the situation, how to stay safe, a list of relevant city programs, grouped by category, a blog feed from our emergency management department, formerly known as Twitter feed, which doesn't quite exist anymore, combining tweets from relevant agencies around us, not just the city, emergency phone numbers, in-language help, things like that. So the collaborative design and content auditing brought all the departments on board with the concept. Then we decided to enlist them in keeping the page and the links current. So in addition to the initial creation of it and gathering all the information from those subject matter experts, we decided to open certain elements of that page schema to content editors across city departments. So we normally have a decentralized content management model on our website and other communications platforms where our team maintains some of the most central information, but we have their experts with web expertise in different departments who have access to do this. So we wanted to take those people and enable them to update things on the fly if they have new programs or they need to change something about it. So throughout the entire project, we communicated our approach to these internal stakeholders to keep them engaged. And once the page was launched, they were excited to have access to keep it fresh and useful because that's the most important thing. And these are evergreen pages that we use. We want them to be always available, but when the emergency hits, we want to make sure they're the most up to date. So we held a training session to walk through exactly how to edit the components. Even though they know most of these things, we wanted to be very clear. And we provided documentation. And then we've since been able to repeat and scale this model. And we created, I forget how many other, at least 5 other weather hazard pages, and even kind of changed them a bit to have the evergreen and emergency version. We actually have 2 different versions now sometimes. So that's where we kind of, in a meandering way, we started with deeper human-centered design, and then we were working with our internal stakeholders on design workshops to then create something and use the change management for that.
Yeah, Michal, thank you for sharing that. And I just want to acknowledge that the city of Seattle is a complex ecosystem because how many departments do you have?
It depends how you define a department, but we'll say like 40 something.
Yeah, 40 something departments. And so you're really helped them move away from sort of a org chart information architecture, and that requires busting those silos like you talked about. So great. So everyone, we are going to transition to some questions about each of these case studies. Before we do that, we have a quick poll for you. It should be showing up on the screen here. We'd love to learn from you. What are some of your biggest challenges with digital adoption? So take a moment to review these options and select it. That gives us a sense of some of the challenges you might be facing. And soonish, we should see results. Oh, it went away. There we go. That's what I was anticipating. So number one barrier is resistance to change from teams or leadership. So let's start there. Maybe starting with you, Wanda. Did you have any resistance on your project? Who were the resistors? How did you overcome it?
Yeah. That was resistance. That's one thing you count on, right? And you have it at every level, right? We even had some senior leaders that, you know, wanted it to happen, but may not have been as confident that it could happen within a short time frame, right? So when you have that level of resistance, it's it's just where the communication becomes critical, right? You need to have like-minded executives in place to be able to have the conversation with the person that has the resistance and understand what is really the underlying concern, right? It's a tough conversation. It has to be handled gently, but it has to be handled effectively. If you don't, it can derail, your entire effort. So you want to be always on the lookout for resistance, especially in your senior leaders, and you want to have a plan in place. And this is where your communication plan becomes critical for you. You want to anticipate that. It's human nature to resist change. It doesn't mean it's a bad person, it's just human nature. But usually, when people understand what you're trying to do, and this is where you need to have a very clear vision and why you're trying to do it, and allow them to express their concern, and then co-create how you work through that concern together, right? When people feel as though they have skin in the game, they'll put forth the effort to overcome that challenge, and that helps you to move forward.
Thank you, Wanda. Anything to add to that from you, Michal, maybe?
I would say for us, we recognized we were doing things differently, but for this example, we weren't actually, while it was change, it wasn't taking away and replacing something, it was adding to. So in this case, we're helping people because the groups we worked with to gather their content, we're basically just cross-promoting and what they've already done. We're not asking them to change what they've done in place. So in that sense, we were lucky for that. And we knew that the department communications teams were stretched thin. So we also approached it in a sensitive way, thinking, how can we make this easier? How can we make it more successful? And so this is one of those examples in our project examples for us that helped us improve our feature development process to make sure we're including communications and training plans, launch and post-launch, like we're really truly end-to-end product development as we do things. So even the small feedback we get throughout working on things, we're constantly figuring out how to do our own continuous improvement.
Yeah.
So Suzanne, something that both Wanda and Michal were talking about was making me think. And that is, I think for the work that we do at the Healthcare Authority, we are very lucky that we didn't have a lot of resistance to the change because we're so aligned on our mission and the purpose, right? Like healthcare coverage matters. We all know that. We've all felt that, right? So we had a lot of momentum with the thought of we want to make sure we maintain coverage. So the buy-in wasn't, or the resistance wasn't there. We had buy-in at that point. I think for us as a state agency, where we tend to stumble a bit, is that it's kind of like we are accustomed to the same recipe over and over and over again. And that recipe is deeply rooted, and we don't like to change, or we think that if we change, we have to do it at full scale. And we have to bake all of these steps into it and then pilot the change to an entire program or population and then implement. And I think what we learned was that we didn't have time to do that in this scenario. And so what human-centered design helped us with is that we didn't need to build a pilot. We needed to be willing to prototype and have small incremental change and iterate, gather that feedback quickly, and then do something about it. And so as I had shared in my story, I think, one, having our team members who answer the calls day in and day out and who were directly talking to those that we serve, hear the challenges, ask them questions about how they preferred to be communicated with, helped us to not only hear the voices of those we serve, but to garner buy-in from the team members who were hearing it live. It wasn't just some edict that was being pushed out that we believe our customers need X, Y, or Z. No, they were telling us what they heard from our customers. And then I think we took it a step further, and we had some of our senior level leaders in the organization shadow those call center agents. Hear the live calls coming in, hear the questions, hear the fear, hear the frustration of those we serve. And so they themselves then had those, again, muscle memories of emotions that were left imprinted on them. And so when we had to then get people from our IT department or our comms department or finance to support us in this non-traditional method of communication, text messaging, we were able to do so because they themselves had had an opportunity to hear directly from those customers and to feel that too. And so I think for us, we are very fortunate to have that alignment in the sort of mission of healthcare coverage. But then I think we had to break down some deep-rooted sort of past practice of always doing things the way that we had done them and just approaching it as typical bureaucratic state government.
Yeah, you had to deconstruct your playbook and rebuild it. Yeah,
absolutely.
Yeah, great. Well, we are getting some questions from the audience. I'm going to weave them in here and there. Your comment, Taylor, about your organization already being aligned on the mission of HCA made me think of this next question, which is everyone out there, you may be familiar with the work of J.P. Cotter. He's an organizational change management expert. He's written a lot of books about it. And one of his perspectives is that it's so important for an organization to create a compelling vision for the change, something that demonstrates what success looks like, a North Star that everyone can align themselves to. So I'm going to start with Wanda. How important was setting a vision in your project? Was there a vision? How was it used?
I think setting the vision is the key, right? And for us, it was around being able to communicate with our taxpayers differently. Instead of going to the physical mailbox, you're able to upload, right? It's like communicating the way that you do with any other financial institution, your bank, right? So the vision and what we were trying to achieve was there, and it was critical to have everyone see that vision. And even though it created change and changing your procedure and thinking through how you're going to interface with this digital portal differently than just waiting for the paper to land on the desk, everyone understood this was providing a good service to the taxpayer. And that was the vision. And being able to communicate with our taxpayers differently. That was absolutely key in getting people to recognize, yes, I've got to change, but this is the reason why. This is the reason why. And I think I was reading, everything starts with the why. Why are we doing this? And once people understand the why, even though there's change that has to happen, they're more likely to get on board when they understand the why.
Trying to come off mute. Understanding the why. Very critical. Does that resonate with you, Taylor, or Michal at all? Did you have to do some of that work of letting the organization know why this change is important, why the status quo is no longer acceptable?
Well, I think just a small point, I feel like we've all talked about how change management, human-centered design, these are the things that people think are fluffy, nice to haves, and can be dropped off a project because we're rushed or it's not necessary. And so having the vision is so important because we need to, it's where product mindset's important even, right? Just coming into a technology transformation. So it's really important, but often underrepresented in government technology. And we need to define the problem. We need to understand the underlying need, right? Not just as Wanda said, understanding what the actual resistance to change was. Also, what's the need for the thing, why we're having the project in the first place, and identify the impact. So it's critical to understand the goals and do discovery to answer all these questions before jumping to a solution. And that's aligned with design thinking, but before we're even quite there, right? And it's like initial discovery and then deep design thinking. We shouldn't be building or changing anything yet. But unfortunately, sometimes people start in the middle.
Agreed. Yeah, the importance of understanding the problem from the end user's perspective or the folks that are being impacted.
Yeah. I'd like to add on to that, Suzanne. A lot of times it's been my experience that we'll approach a project and effort for the technology's sake, right? Oh, we found out about this nice new slick technology and we want to implement a project to implement this technology. No, no, no. Right? I mean, that usually creates a lot of frustration and the value is often questioned, right? It's not there to solve a business problem. We're there to test out this new technology, and where it may sound very groovy to do that. I know I'm using a really old word there, but it's about what problem are we solving? Why are we doing this? How does it make the customer's life better?
I'm going to be quiet because I'm very passionate about that topic. Wanda, I see too many technologies searching for the problem versus starting with the problem and then figuring out what technology is the best match. Thank you for sharing that. Like-minded there. Next up, I'd love to talk about the role of executive champions in your change efforts. Who could comment about that one?
Yeah, I'd be happy to start. I think as I had shared, we for our initiative, we approached it by also including executives and senior level leaders in the experience of answering or hearing live feedback from customers in our call centers. And I think that was instrumental for us. And it's actually a practice that we've continued. We do it a couple times a year. We open it up to anyone within the agency that wants to shadow one of our call center agents across the organization. And I think the learning there for us was, again, like it's easy to manage from a report or something that you read, right? But to get up and go see, to hear the conversation, to see what the team members are going through, that leaves that impression that then is there in future conversations when we're contemplating additional initiatives or something like that. Those executives remember that experience. And so that memory recall then helps to shape their future actions and decisions in policy making or resource distribution. So I think for us, executive level buy-in and engagement was definitely a critical factor to the activities that we've performed, and they've sustained. We've maintained the interventions that we implemented with the text message campaign, with robocall opportunities. And I will say, we also fully acknowledge that especially for the populations we serve, a digital intervention is not always the solution. And so we also go out to facilities and gather feedback directly from our beneficiaries that are there in person. And we will always have a snail mail paper opportunity as a part of what we're doing, because not all of our beneficiaries have access to digital devices or even have coverage in some of our really rural communities. So a lot of learnings there.
Yeah, thank you, Taylor. Thanks for sharing.
I wanted to add about they may be mid-level or peer level or however we want to describe them. I wanted to give a shout out to the people on the ground who know the users, know their customers, do the work and get it done. They're the best. They have always been the best champions and can help us amplify to executive levels. So for example, our team organizationally, we're located in the IT department, but we're really at the center working with all departments. So we have open channels, open communication channels to our partners who have to use our products internally to manage content and get their messages out there. So we work with them constantly and they can be champions. We also work with our own department's communications team to raise awareness in channels that they manage, like newsletters and the intranet. And in the current mayoral administration, and hopefully in the future one, we've had success with our contact on the communications team to amplify and support our approaches from a different angle. So even when we're not in the room, is helping to explain why we do things a certain way or why everything needs to be human-centered, why we need to write in plain language. And that's really, really helpful. But in addition to that, I myself and some of my colleagues offer to present in a variety of settings. So anytime we can get on the agenda, we're willing to do it, where mid-level and senior champions may be. So it really doesn't matter, to be honest, what the specific initiative is, as long as we have an opportunity to build a general understanding of human-centered design and support for culture shifts, right, is meaningful and can be applied to any project. I know we've all talked a lot about this, about how it's a behavioral and mindset and cultural shift. It's not just about technology.
Yeah, beautiful. Sometimes I think some of these digital transformation efforts take months, years to launch. So I'm curious what each of you have done to kind of celebrate accomplishments along the way so that folks stay engaged in the change effort.
I'll jump in. For our initiative, document upload tool was one initiative, and we had several others. But what I found really, really important and it was a short window to implementation, was to celebrate the little things along the way, right? When someone got their procedures, you know, 80% and they felt good about that, you got to celebrate those wins, right? Even though we hadn't hit the big implementation, you got to shout out the little things, right? The progress that people are making, because that makes them want to do even more. And I was
Yeah.
talking a little bit earlier about keeping those forums for communication open. Those are so essential because that's your forum to congratulate people and to celebrate those little wins along the way. Because we had about 9 initiatives, so there was a long window for all 9. But for that particular one that had this really short time frame and this really big impact, you really wanted to celebrate those wins along the way.
Yeah. Otherwise, it's a long time before people feel like they're accomplishing something. Yeah, Taylor.
Yeah, going back to what I said when I introduced myself, I think, you know, again, I'm an agent of disruption. So I'm not a fan of this. It takes months, years, whatever to implement. And I think those we serve are much more accustomed to outside of government and bureaucracy getting results delivered in a much quicker fashion, as we all are with the way that life has evolved. And so I think for me, it really has been in the last number of years about getting our teams comfortable with small iterative improvements. It doesn't have to be a redesign of the entire system for every population we serve, for every document, start to finish, for us to make improvement. And we have to be comfortable with, quick wins, small progress, like in the example that I had for our use case, when we were surveying the clients, the customers, the beneficiaries calling in, it wasn't a statistically valid sample and representative of the demographic across the spread of our 2+ million Washingtonians. And that was hard for some people to accept. And it was like, okay, but if we went that path, we would never have been able to balance the need for rapid implementation in order to meet that North Star vision of reducing coverage loss. We would have had far more people who were negatively impacted by having their coverage terminated when they were actually eligible. And so I think we have to get better about not having the multi-year project and implementation, and much more comfortable with that small iterative improvement. And I think to go along with that, like, we have to create a culture where there isn't a fear of failure. Like, we're human. We're doing real-time experimentation with humans, and we're going to get it wrong sometimes. So if we can learn from whatever that was that we had anticipated to go one way that actually went another, then that's not a failure. That's informative and something we should take and apply to the next sort of iteration. But we have to be willing to embrace that and get out of the cycle of like designing for perfection and having that perfection take multiple years, because by the time we implement, it's outdated anyway.
Yeah.
I love what Taylor said, but I just want to add something for some nuance. I think I agree completely. Incremental changes are the best way to do anything and benefit the public as quickly as possible. However, we need to make sure that the people we're working with understand that even those incremental changes still have to fit within our standards and our requirements, because we still have people who nod when we talk about human-centered design and at the same time expect us to make design changes ad hoc, which would create silos instead of how we approach something with global consideration. Even if we do something small, it still has to go through the entire ecosystem and consider the experience for all the users and all the impacts and the things we've all been talking about. So it's really challenging to explain that fast and incremental doesn't necessarily just mean do what I say and do this one thing I have in my head, because it's not good for users. It creates design debt. And that's what we've been trying to undo with all of this work that we've all been talking about. So some of that I feel like is always a difficult conversation to navigate.
Yeah. Wanda, I know you just came off mute. Did you want to add to that?
No, I agree with, what everyone said. I think that, building things iteratively, being able to have those short deliveries are so important. As long as we take the time to recognize the importance of each of those deliveries and celebrate them with the folks that are making it happen.
Yeah. Yeah, well said. Well, you really touched on all the sort of tenets of the human-centered design process, Taylor, iteration, bias towards action, and all of that. Next up, I'm going to open up the floor to questions coming in. There is one I'd like to start with, but for everyone in the rooms, please put your questions in the chat. And Wanda, Taylor, and Michal, our first question, I don't know if you can read it, so I'll read it out loud. But it's intended for any one of you. What big organizational or digital changes do you see coming, and what lessons will you apply from these case studies to them? Give you a moment to think.
Well, I can tell you one that is probably no surprise and is, demanding our doorsteps go blown wide open is AI, right? And so I will just say, I think there is a real desire to explore artificial intelligence and what it has to offer across our sort of digital enterprise, whether that's through chatbots or robo processors or whatever it may be, right? And I think we're at a point where we're trying to explore how do we do generative AI responsibly, and an acknowledgement that there will always need to be a human involved in some part of our processes. And so while there may be the big sexy allure of AI being more efficient than the people that do the work, like we have to help dispel some of those myths and balance where implementing AI in a responsible way frees up the capacity for some of our, humans in the mix to bring forward the unique experience and expertise they have at a higher level and apply that to the work that we do. So I think that for me is one that is a constant sort of like at the forefront of every conversation I'm in right now.
I can add what I have accessibility on the brain. That's another big project that we're working on. So across the city, trying to meet the federal deadline of April 24th, 2026, to make sure all web applications and content are accessible. And these learnings definitely apply there because we're working across the city, gathering people who we don't always work with, people who think this is overwhelming as it is. Unfortunately, they haven't followed the instructions that have always been there, but for a variety of reasons. And so now there are people representing who are now like kind of burdened from each department with making this happen. So we have two objectives on that project. One objective is to evaluate and remediate all the things. The second objective is just to create an accountability structure and operationalize accessibility in business processes in our culture. And so that's the part that I don't want to say we're struggling with. We're getting there because people are still so focused on the remediation and the technical stuff we've talked about. But really, people have embraced the idea, but that's a huge, huge change. It's a culture shift. It's mindset. We've been presenting to people about changing behavior in their everyday work, right? The way you use spell check, start checking accessibility in a document. Don't think about whether it's for the public or it's an application yet. Just change your behaviors and think about the amplification of 13,000 employees changing their behaviors little by little will change the way we work. And then everyone will their antenna will go up, whether they're in procurement or design or business analysis, thinking about a new technology project. So that's another thing where I think change management is huge.
Anything for you, Wanda, on that?
That's a very good question, and I was thinking about it. And since I retired, I leave this for my colleagues. I think the next challenge is, building on what Taylor said and Michal said, the data, right? It's all data behind all of the digital interfaces, right? So how are we able to use all of that data in consideration with the many legacy systems that I'm sure the state and local agencies have, as well as the federal government? How do we harness and how do we use the data effectively, right? Because it's one thing to offer a digital portal, how you take that information in, and then how do you use that data along with the data that you already have to make things even easier for the citizen. It is really the next wave in my mind.
Yeah, yeah. Yeah, we are coming at time, and so I want to ask one question that our panelists might not be expecting. Just quick answer to this. For those of us in the room, in the audience today, who are just starting to think about this combination of human-centered design and organizational change management, what sort of short tip do each of you have for them to get them started? And I'll let you just come off mute as it comes to you.
My short tip,
I'll
curious. Stay curious.
Stay
That's
curious.
my tip. Yeah.
Love that. Stay curious. Wanda.
Focus on your why you're doing it.
Wise words. And Michal.
Okay.
Sorry,
Also, just there are a lot of great resources. I mean, AnthroTech writes great blog posts that I see on LinkedIn. Nielsen Norman Group is a wonderful resource with like these bite-sized chunks. But as someone who's our team has gone and done competitive analysis every time we do work, is look at what, if you're in whatever level you're on, state, federal, local, or even in between, look at what other people are doing. Often this is public facing information. So maybe someone has published a blog post about a project they've done that you can also view the work because they have a website about Apple Health, right? And so you can see the actual, what the consumer sees. You can also maybe they've written about how they approached it. And so I think it's really great to learn from what other people have done, because we might, unfortunately, it seems that we don't always have like where one person solved it all for the rest of us, but we can at least see from a different point of view what people have done and how they've approached it, and see whether that would work for you. So I feel like looking at other agencies is really a great way to look into this.
Yep, love it. Well, thank you so much, Wanda and Taylor, Michal, for the insights, the stories, the strategies, and thank you everyone in the room here for spending this hour with us. Please keep an eye on your inbox over the next couple of days. We're going to be sending you the full recording of today's session. And speaking of resources, we'll also send an exclusive resource to download, AnthroTech's change management approach. It's a practical guide that walks you through how to prepare for change, manage it, and make it stick. So on behalf of all of us at AnthroTech, thank you for being part of this conversation and for the work that you're all doing out there to make services work for people. Have a wonderful rest of the day and a wonderful holiday season. Thank you.
Thank you.
Thank you.